So before Cole share the experience, his experience with the audience, I'm gonna show what Cole looked like before, and we did the FUE method, and we did almost 2,400 grafts, and filling the whole frontal area, work our way to the back, and so we're gonna go all the way from the beginning, really, and that was him before, a year later, and you see how with a full set of hair, he looks natural. The hairline looks natural and dense. Okay, and so go ahead, Cole. Why don't you start from the beginning? How hair loss affected you and your research and the surgery day and the recovery.
Sir, well, a few years prior to the operation, I started having hair loss, and it started affecting me a lot in my everyday life, just in confidence issues and stuff like that. So I started looking in, doing some research into the hair operation when I started being highly intrigued by the EFU operation, and I looked around at all the doctors that I would consider doing such an operation when I came across Dr. Diep online, and we started watching some of his tutorial, his videos and patients, and were blown away, very impressed, and felt confident by everything that had been done by the doctor, and that's how we had decided to choose Dr. Diep.
Can you share your experience on the surgery day? Do you remember anything? And then the recovery too?
Yes, very much. I was really worked up prior to my operation, and I got down here, we had a long drive, and I was ready for it. I was excited for it. My fear kind of went out the window, and Dr. Diep and his staff had the most professional, safe, clean, good energy office where all my worries went out the window. Everything went very smooth, very to little no pain. Mm-hmm. Afterwards, I had a little bit of inflammation and some redness that concerned me, but any of my questions were quickly answered and alleviated, and it was a very enjoyable process.
Sure, okay. And how about when the hair regrow for you, Cole?
My hair took a little bit longer than I had anticipated it to come back, but all this I knew in the beginning with talking to the doctor that it could take upwards of 12 months to have full hair growth. I started seeing really, really good results around 7 months. But even up to 7 months, I was seeing progress. It just wasn't as thick as I wanted to. And now, sitting here after a year, I'm very happy with where my hair has come to this point.
Yeah, okay. So, so that's where Cole is. So again, 95%, it takes a year for it to fully grow. And it's pretty rarely you have growth rate around 3 or 4 months. And most people knew that they were bald and they had a surgery done, but they forget how bald they were until they see the before and after. And when they're doing the growth rate back, most of the time, because you keep looking at it every day, you don't see much to change, And so for Cole, I think your girlfriend was the one who noticed it first,
sir.
Right? Yeah.
Yes, sir.
And other people will notice your change slowly, and he definitely looked younger.
And they have. Yes, even the other day somebody came up and said, something's different about you, because my hair in the beginning wasn't fully bald. It was just really thinning. So to me, every day I didn't see the progress until I come around people who don't see me every day, or I get back to those videos, and it really recalls the significant growth rate that I have had here with Dr. Diep.
And thank you, Cole, for really allowing to show the full face, and really to help the audience too, because you on the other side and watching other clients allow to see their before and after, right? And
yes, sir.
See if it's real or not. And some of my clients say it might look too good to be real.
Yeah.
And you're the living proof. I mean, you're my walking billboard and my work of art,
Yes.
really. Yes. And that's one of the greatest joy of my work, really, to transform people, to help people.
Yes.
Without having to save life in the hospital. Really, for me, just saving people, really bring back the look and the youth back. And
you did, and you brought my happiness back, and I'm so much more confident with myself with my full head of hair, and I'm really glad that I didn't wait the transition from going to thinning to bald was something that I didn't want to do. So it was really important to me in that time to get the operation done and then stay consistent as much as possible with my hair.
Yeah, you have one option. If you reach around near 30 or 30, and you don't have to wait until completely bald and get something done. Yeah, you can. You sit there for these many years of not looking great. Or, you know, if you're a candidate for it and financially if you can handle it, why not do it? You have one life to live, right?
Yes, sir.
The key word is that when it comes to FUE, you got to find someone who's really specialized and who does it manually. To get you the most healthiest roots and just give you the density, and that's one. And the other thing is there's the whole artistry behind it too, because you know you don't want to have hairline where it looks too high and leave you a big giant bald head,
Right.
big head, or too low, because you want to be able to sit in front of people and no one know you have had surgery, and that's there where the artist and the surgeon to give you the most healthiest roots. And Cole is my
Thank you,
proof
doctor.
right here.
And even the people closest to me wouldn't know that it was done unless I told them.
Yeah.
It has been done so well. So again, thank you very much, Dr.
All right. Thank you, Cole.